Every minute spent on treatment for medical emergencies or high-risk patients could reduce their chances of survival or proper recovery. However, with the availability of technology in emergency rooms, patients are able to receive efficient procedures and treatment needed for their survival. Hi, I'm Maia Dioso, and today's question is, to what extent has the Internet of Things impacted the effectiveness of emergency rooms in the United States? Adopting advanced technology in the medical field has significantly improved the work ethics and lives of workers and patients. Factors like simultaneously running devices, a greatly organized system, data that can be transferred instantly, and the whole emergency department process is very quick and reliable. All of these come together to create the highly effective emergency department known today. Reasons someone might visit the emergency room is because of injury, pain, illness, or infection. For better treatment opportunities, new medical devices are being invented and incorporated in facilities, and healthcare organizations dedicate an average of 10% of their overall budget on those devices. And this is expected to reach an average of $72.02 billion by 2021. So by implementing rapid technology, they are able to aid in producing a fast-paced and efficient working environment. With an average wait time of around 28 minutes, patients are able to receive the care they need as soon as possible. Shown here is the latest map and case count for COVID in the US, and the colors represent the average daily cases per 100,000 people in the past week. The darkest color being the greatest amount, which is in Lincoln County, Colorado, with 1,030 new cases. And the counties with no reported cases are labeled as white. And with corona cases being at an all-time high, with more than 11 million confirmed cases, the crucial need for treatment is more important than ever. Hundreds of new patients are being admitted into the ER every day, and with most hospitals at their breaking point, the available technology is running at 24/7 and simultaneously providing for each individual. In order to keep track of hundreds of patients at one time, a great example of data being transmitted instantly is the use of barcode technology. Shown here are barcode technology examples in use. This being medication, identifying patients, and treatment plans. And barcode scanners allow for medical workers to have an effective admittance process, and it's great for reducing incidents of error. Since most modern emergency departments utilize the use of electronic health records, these include medical history, diagnoses, medication, treatment plans, dates, and test results. Most all of devices used in the ER work hand in hand when processing a patient's information and treatment plan, where data is stored in a platform called the cloud, and it can be shared instantaneously. And results from tests and procedures can be accessed quickly, resulting in the greatest care and a comfortable experience for everyone. But a common risk that comes with any device connected to the internet are potential cyber attacks. The connections shared between healthcare technology can be easily accessed by hackers, which have the potential to alter information and devices, steal and sell patients' information, or be used for nefarious purposes. The chart here shows the main 4 consequences that are a result of cyber attacks. The greatest one being operational downtime, which ultimately puts the whole emergency department on pause. This disrupts the system and easily puts the lives of others in danger because they're not receiving the care they need. But the possible solutions and safety measures that can be done to prevent cyber attacks include limiting the access to the network, installing and maintaining an antivirus software for the greatest possible protection at any given time, and by educating workers to create a culture of security. And by doing this, the issues revolving around an insecure IoT in the emergency department can be tamed, and a risk of a system disruption are less likely to arise. In conclusion, the availability of technological devices in the emergency room have proven to improve the work lives and ethics for everyone in the ER. Even with the high risk associated with these devices, they have not deterred the emergency department or the healthcare organization from using them. Because with this, the emergency room and procedures are more than capable of advancing the industry and saving thousands of lives. Thank you. Questions?
I do have two questions for you. First up, how valid and reliable were the sources that you used, and how do you know?
So I was looking a lot online for different information about the emergency room. And I got most of my information from different health organizations like the CDC, Mayo Clinic, National Institute of Health. So I mainly got most of my facts from there because I knew they were reliable. But there is this one website where I was looking into how much is spent exactly in the emergency department. And all of these like blogs kept referring to one research website. So I looked into it, and it was a key example of a website not to trust. So everything I gathered from that website, I just got rid of completely.
Okay. And what advice would you have for other researchers who consider this topic?
I would say to know your medical vocabulary and to know exactly what each device or factor is called, because I actually didn't know that there was a difference between electronic health records and electronic medical records. Electronic health records being records that are able to be shared with many devices and edited with those devices, but medical records can only be shared and not edited. So make sure to know what that is and to do your work on time, because I slacked a little bit.
That's good advice.